Hello, Mr. Presley. My name is Crystal Herrera, and I'm going to be your occupational therapy assistant. How are we doing today?
Doing good.
All right, that's good to know. According to my notes, you are 3 days post-op from a total hip replacement, and we're going to be working with you to prepare you to go home in the next 2 to 3 days. So, in order to do so, I'm going to go over some hip replacement precautions with you, and I'm going to demonstrate those right here sitting next to you. And after that, we're going to do an activity of daily living in which I'm going to help you to put on your pants with an assistive device called a reacher. And so I'm going to go ahead and get started with the safety precautions from a posterior approach, and then we'll get into that daily activity of putting on your pants. Okay, first off, whenever you're going to sit down, it's very important that we protect your new hip replacement. So what you're going to do is you're going to slide out your post-operative leg, and then you're going to put all of your weight on your non-surgical leg. And arm bars are good to have so that you can also put all your weight on there as well, because we want to keep as much weight as possible off of that post-surgical leg. Okay, so you're going to sit down. It's going to look like this, and then you're going to sit down. Okay, so first things, we definitely want to avoid flexion. So that would mean just coming anywhere a motion like this, coming from decreasing further than a 90-degree angle. So we definitely want to avoid that. Also, internal rotation of the knee. So you definitely want to avoid this motion here, because that can also cause your hip replacement to pop out. And then also adduction. We want to avoid adduction at the knee. That happens when you cross your leg, your foot over your leg. We don't want to do that. Also, to be bringing your ankle to the top of your knee, we don't want to do that as well, because all of those movements will cause your hip replacement to pop out, and thus you will have to possibly have surgery again. So we want to avoid that. So do you have any questions for me on that?
No.
No? Okay, perfect. So let's go ahead and get started with your activity of daily living, and I'm going to show you how to put on your pants with your reacher. Okay, so what you're going to do here is you're going to have your pant rolled up, and you're going to start with your post-operative leg, and you're going to stick that right here. You're going to grip it right here, and then you're going to put it over your foot, and then go ahead and use your other hand to assist you, and then you're going to roll up the other pant, do the same thing, and I'm going to observe you and see how long this takes you, just for my own notes. And then also, I wanted to thank you, Mr. Presley, for wearing your non-slip socks, because that is also a very important safety precaution. Okay, so I'm gonna go ahead and let you get started on that. And I am here to assist you if needed. And remember, we want to avoid flexion at the hip greater than 90 degrees, okay? And you don't have to necessarily get all of it, just enough so and I can also assist down at the bottom if I need to. Okay, I'll go ahead and assist you. These are some pretty thick pants. Okay, so go ahead and use that reacher to bring up the rest, and then you can use your other hand. Okay, so now you're gonna do the same thing with the other leg. And this definitely takes practice, so do not worry if you're not getting it. This is your first time doing it, so you will get better over time. There we are, perfect. Perfect. All right, awesome. Now that we're at this point, I'm gonna go ahead and assist you with from sitting to standing. Okay, and we're gonna go on 3. All right, so okay. All right, Mr. President, we're gonna go on 3. 1, 2, and 3. thank you. And I also have here another assistive device. This is to keep your balance as you're finishing putting on your pants. All right, great job. All right, Mr. Presley, good job. So now you can go ahead and position yourself to get ready to get seated. Like I told you, go ahead and slide out your post-operative leg just a bit. You're gonna put all of your weight on your non-surgical leg, and you're going to use those armrests. And perfect. Awesome, Mr. Presley. You did a great job with me today. Do you have any questions for me?
No.
All right, thank you so much.